In this video, we are going to be looking at blood transfusion safety, part 1, where we are addressing on the definition of transfusion safety, the activities involved in transfusion safety, the goal of transfusion safety, hemovigilance surveillance, the defined adverse reactions and other adverse reactions that can occur during transfusion reaction, and the incident glossary in relation to transfusion reaction. Happy listening and learning. Hi, I'm Sharon. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. Nearly 120 million units of blood are donated every year. Hence, we see that there is a massive need to maintain safe and effective procedures around the collection, storage, and use of donated blood. Collectively, this is called hemovigilance. These procedures cover the entire blood transfusion chain and are used to standardize the use of blood in healthcare. Now, let's look at the definition of transfusion safety. It is the practice of maintaining safe procedures for the collection, storage, and the use of donated blood. Transfusion safety is important because transfusing incompatible blood can cause serious life-threatening reactions. However, the risk of infection can be reduced by proper screening. Let's look at the activities involved in transfusion safety. It begins with donor selection, where careful screening and assessment identify healthy low-risk donors. This is followed by laboratory testing of donated blood to detect transfusion transmissible infections and ensure blood group compatibility, which is followed by component collection and preparation that allows the blood to be separated into specific components, enabling appropriate and effective use. Finally, monitoring of transfusion recipients is essential to promptly identify, manage, and report any adverse transfusion reactions, thereby ensuring patient safety and quality care throughout the transfusion process. Now, let's look at the goal of transfusion safety. It is to reduce the risk of complications and improve patient safety. Some risks of a blood transfusion include transmitting diseases, allergic reactions, fever, and iron overload. Hence, we understand why it is very important that transfusion safety is in place. Hemovigilance surveillance is a comprehensive system that monitors the entire blood transfusion process from transfusion-related activities, that is, patient sample collection, sample handling and testing, inventory management and patient monitoring, to the actual transfusions, which includes the number of components and the number of patients and their outcomes. This diagram illustrates that not all transfusion-related activities lead to transfusions and not all transfusions result in adverse outcomes. Within transfusions, you can see reactions that occur, which represent adverse events that occur in patients following blood transfusion. And incidents involve errors or deviations in any stage of the transfusion chain, such as sample collection, testing, or administration. And some incidents may occur without causing any adverse reaction, whereas some incidents may occur which cause adverse reaction. The overlapping area thereby emphasizes that hemovigilance captures both clinical reactions and system-related incidents, enabling early detection of errors, prevention of recurrence, and continuous improvement in transfusion safety and patient care. Let's look at the defined adverse reactions that can occur during a transfusion or after. The first one is TACO, which is transfusion-associated circulatory overload, which is a transfusion reaction caused by rapid or excessive transfusion volume leading to acute pulmonary edema and heart failure. The next is TRALI. It is an acute, non-cardiogenic lung injury occurring within 6 hours of transfusion, characterized by hypoxemia and bilateral pulmonary infiltrates. TRALI stands for transfusion-related acute lung injury. The next is TAD, which is transfusion-associated dyspnea. This is a new onset respiratory distress occurring during or within 24 hours of transfusion that does not meet the criteria for TACO or TRALI. Allergic reaction can be severe, life-threatening or fatal, which is again an immune-mediated reaction to plasma proteins, causing symptoms ranging from urticaria to anaphylaxis with airway compromise or shock. The next is hypotensive transfusion reaction, which is a sudden drop in blood pressure during or shortly after transfusion, often associated with bradykinin release or ACE inhibitor use. The next is febrile non-hemolytic transfusion reaction, which is fever and or chills during or after transfusion caused by recipient antibodies reacting to donor leukocytes or cytokines. The next is acute hemolytic transfusion reaction, which is a life-threatening reaction due to ABO incompatibility, resulting in rapid destruction of transfused red blood cells. The next is delayed hemolytic transfusion reaction, which is again hemolysis occurring days to weeks after transfusion due to an anamnestic immune response, that is a secondary immune response against donor red cell antigens. The next one is delayed serologic transfusion reaction, which is development of new red cell antibodies after transfusion without clinical or laboratory evidence of hemolysis. The next is transfusion-associated graft versus host disease, which is a rare fatal condition caused by engraftment of viable donor lymphocytes attacking the recipient tissues. The next is post-transfusion purpura, which is severe thrombocytopenia occurring 5 to 10 days after transfusion due to alloantibodies against the platelet antigens. The next one is transfusion-transmitted infection, which is infection transmitted through the transfused blood or components despite donor screening and testing. Let's look at the other adverse reactions. Bronchospasm, which is manifested as wheezing, chills or rigors, disseminated intravascular coagulation, that is DIC, is a severe condition where the body's blood clotting system becomes overactive, forming tiny clots throughout the blood vessels, which then consume clotting factors, leading to both excessive clotting and severe bleeding. Edema, epistaxis, otherwise nosebleeds, hematuria, which is blood in the urine. Hemoglobinemia is a condition where there is excess of free hemoglobin in the blood plasma. Hemoglobinuria is a presence of free hemoglobin in the urine, usually from extensive red blood cell breakdown or hemolysis inside the blood vessels, causing dark-colored urine. Next is hypoxemia, which is abnormally low oxygen levels in the blood. Jaundice, characterized by yellow color of the skin. Oliguria, which is reduced urine output. Pruritus, which is itching. Shock, shortness of breath or dyspnea. Urticaria or hives, which is a common skin condition causing itching, red wells or wheals that appear suddenly, varying in size and shape, and can occur anywhere, often fading within 24 hours, while new ones form elsewhere. This is driven by histamine release. When an adverse reaction occurs, it is required to report it. And it has to be done based on the incident classification using the incident codes. Now, let's look at the incident glossary and its result. The first incident is product transfuse, reaction, no recovery, harm. Here, a product related to this incident was transfused and the patient experienced an adverse reaction. The next incident is product transfuse, no reaction. So, no recovery and no harm. Here, a product related to this incident was transfused, but the patient did not experience an adverse reaction. The third classification is no product transfuse, unplanned recovery, which is near miss and unplanned recovery. Here, there is no product related to this incident transfused. The incident was discovered ad hoc or by accident or by human lucky catch. The next classification is no product transfuse, planned recovery, which is near miss, planned recovery. Here, no product related to this incident was transfused. The incident was discovered through a standardized process or barrier designed to prevent errors. The following are the references. Do look out for part 2 of this video.